severe it is. For that first hyperthyroid phase, often no specific treatment is needed at all.
Really? Even with high hormone levels?
Yeah, because remember, it's usually mild, it's temporary, and it's caused by leakage, not overproduction. So it often resolves on its own. If symptoms like a racing heart or tremors are really bothersome, a beta blocker like propranolol can help manage those specific symptoms.
Okay, just symptom relief. And you mentioned earlier there's a type of drug to avoid.
Yes, crucially important. Antithyroid drugs like methimazole or PTU, the ones used for Graves' disease, they should not be used for the hyperthyroid phase of PPT.
Why not again? Remind us.
Because those drugs work by stopping the thyroid from making new hormone. But in PPT's hyperphase, the gland isn't making too much, it's leaking stored hormone because it's damaged, so those drugs won't help, and they're not appropriate.
Got it. Vital distinction. So, beta blockers if needed for hypersymptoms, but no antithyroid drugs. What about when someone enters the hypothyroid phase?
That's different. If the hypothyroidism is significant, our source suggests maybe a TSH over 10, or if the woman is having clear symptoms like major fatigue or depression, then treatment is recommended.
And that treatment is?
Levothyroxine. It's just synthetic thyroid hormone, replacing what her own thyroid isn't making enough of.
Okay, straightforward replacement therapy.
Pretty much. And there's a specific note for women considering another pregnancy soon. The goal is usually to keep their TSH below 2.5 while on levothyroxine, as that's considered optimal for fertility and early pregnancy.
That's really practical advice. If someone starts levothyroxine for PPT, are they on it forever?
Not necessarily. Because PPT is often transient, the recommendation is to recheck thyroid function after about 6 to 12 months of treatment.
To see if the thyroid has recovered on its own.
Exactly. If the tests show that the thyroid is working normally again, the levothyroxine can often be gradually reduced and stopped.